Our keynote speaker here, Representative Rob Nosse. Is he? Oh, yeah, there he is. I'm going to introduce him. Yes, Representative Rob Nosse is currently the state representative for HD 42, which consists of inner southeast and a little sliver of northeast Portland. He has been the state representative for this area of Portland since 2014. In 2021-22, he served in the Ways and Means Committee, where he was the subcommittee co-chair of Human Services, and he also served as vice chair of the House Behavioral Health Care Committee. With those two roles, Representative Nosse was able to steer over $1.3 billion in state, federal, and state marijuana revenues into a series of behavioral health bills and budgets, one of the largest investments in behavioral health, mental health, in decades during the 21-22 sessions. He currently serves as the chair. He currently serves as the chair of the House Behavioral Health and Healthcare Committee, where he worked on two big bills, one on Bill Measure 110 operations and another about hospital staffing. In 2023, he's worked in bills and to address abortion access and transgender health care, hospital staffing, particularly for nurses, and fixes in the operations of ballot measure 110. In 24, he was part of the effort to bring law enforcement rollback into addictions challenge in the state, helping to pass HB 4002. He's also the leader of a newly created Arts and Culture Caucus, trying to get more support for arts and culture opportunities across the state. Representative Nosse lives in Southeast Portland with his husband, Jim Layden. He is an activist organizer at heart. He has worked an entire working life in trying to make positive social change for students, working families, and nurses. He started out as a student organizer in the 80s and 90s with the Oregon Student Association, trying to support public higher education. He then went on to work for the Service Employees International Union, Oregon Nurses Association in 2004 to 2020, where for almost 20 years. No, okay, you gave me all this. There's a very accomplished background, I have to say.
Try. Okay.
Okay, thank you.
Thank you.
But he's also keeping us on time.
Okay. How much time do we have?
You have quite a bit of time.
Quite a bit of time. Okay. So, thank you for that introduction. I didn't mean to rush you off, but you know, I'll just say this before I kind of get started. I'll try to be have you engage in a little bit of participation, because keep in mind, we still exist in a democracy. And part of existing in democracy, you know that you're in a democracy, okay, when you have the ability to criticize your leaders, okay? And I take that very seriously. It's not fun to be criticized, okay? Like, I agonize over every decision that I make. Sometimes the decisions that you have to make, it's really like, what's the least bad choice, okay? Because we don't always have enough resources and enough money or enough humans working on a problem to really get it fixed, okay? So you try to make progress, or you try not to do harm, okay? So I hope this will be a little bit participatory. There'll be time for questions and a little bit of hand raising, just because I think that's an important part of democracy, that you get to engage with your leaders and you get to criticize them. We're also, I just want to say this, we're really lucky that we have Ebony Clark in the role that she's in. So she didn't tell me to get up here and say this. I'm always glad that she keeps doing her job. That's a joke between her and I, because she has a very hard job. But I didn't start out to be a behavioral health legislator. I thought I wanted to fix higher education. That's what I got politically active around in the 90s. And I wanted to fix our tax structure, which is messed up in this state, because I wanted to pay for things so we could have services and supports, lower tuition, better health care, all the things that we expect government to try to provide for us. But instead, I didn't get to chair the tax committee, and that's a long conversation that's very boring, and we will not have it here today. And the consolation prize was that I got put on a budget committee in the state legislature in my third term. And then I really came to understand that policy is important, but if you don't figure out how to spend money to support the programs and the policies that you say you want to do, you're not really accomplishing anything. It takes resources, money and humans, to make something happen. And so Director Clark was, when she was at Multnomah County, gave me pretty much most, if not all, the foundational knowledge I have about our state's behavioral health system. And we're lucky to have somebody who has lived experience and a professional background. It's nice to have both, okay? It's nice to understand what it's like to deal with pretty difficult challenges, but also to have an education and experience so you can figure out how to make things happen. Good luck, okay? All right, I don't have any slides, okay? So put your phones down. You're just going to have to listen, okay? I didn't make a PowerPoint, okay? And remember I said politics is supposed to be a peaceful way to resolve differences and set up our society and distribute resources in ways so that we can figure out how to live amongst each other, okay? And as I said before, democracy is about being involved in picking our leaders and making our laws. We don't just have kings and queens in the United States, okay? Nor do rich people or religious leaders get to decide everything, okay? And I got a little bit of bad news as I walked up here on the stage, okay? I'm sure a lot of you are anxious like I am. Imagine being in a role where you're thinking about how government's going to manage, okay? Whatever the outcome of the election is, okay? So in Portland, liberal Portland, a ballot box got shot up and fired at last night. So it's already kind of starting. And I don't make any assumption about what kind of politics that could be, all right? We don't know, all right? But hopefully not many ballots were harmed and that the county elections office will be able to evaluate what happened to those ballots and be able to reach out to those voters and give them a chance to come vote. I'm confident that will happen. So this is a conference about behavioral health care, okay? But I want to give you a little bit of insight into what your state legislature has to deal with, because unfortunately you're not the only thing. And it's too bad you're not really the only thing, because as Director Clark kind of pointed out, we're doing better in your space, but we're under-resourcing what we need to do to make positive change and improvement. We're getting better, but not better enough. So I think all of you know the election is November 5th. How many of you are eligible to vote? Raise your hands. Okay, everybody's voting. Excellent. Okay. The legislature, in theory, is part-time in this state. We start legislating in late January. We legislate for 5 to 6 months to pass a bunch of bills and pass a budget for the state that exists for 2 years. So things that are on our minds. Who's going to be the president? Which ballot measures are going to pass? So there's 5 statewide ballot measures, but I think all of you came from all around the state, so you have local measures in your communities as well. Will the Democrats, and I'm a Democrat, so I'm a smidge biased, okay, will the Democrats have supermajorities in both the Oregon House and in the Oregon Senate and be able to rule the day, so to speak? Who will the leaders be, okay? The personalities of those people and their political priorities shape the outcome, okay? So politicians are just like all of you. They are shaped by their parents, their education, the career that they chose or maybe fell into to be able to make money or to self-actualize, whether they have a faith tradition or not, okay? All those things shape me, okay? And they shape the other leaders that you interact with or demand something from. So here, just so you know why this job is hard, I'm not up here to make this be a therapy session about me, okay? I could. It's a little indulgent. Okay, so in no particular order of importance, here are the other things that are on the agenda besides what do we do about addictions and mental health, okay? Are we going to make any progress on trying to figure out how to get more energy that is clean instead of derived from greenhouse gas emissions? It's really hard. I'm betting most of you drove here. I'm betting most of you charge your computers and your cell phones and don't want to live without electricity. Will we figure out how to make child care more affordable and pay low-wage workers who take care of the elderly and the disabled and the mentally ill better? Okay? $20 an hour is really not that much, even in rural Oregon. Will we make more investments in chip manufacturing or other kinds of manufacturing and attract, good jobs and good industries to our state to keep our state viable economically? The guy that was going on a little too long about my resume, he mentioned the arts, and we only spend $6 million in a $1.21 billion budget for the state of Oregon, $6 million officially on the arts. And we think about how the arts help us understand our humanity, help make our communities fun, frankly, okay? And the state is only spending $6 million on that. Can we get our arms around housing production and the homelessness crisis that we're experiencing? We have to do that. That is why Governor Kotek is so focused on it, okay? And can we build more housing and lower costs and lower rents, okay? I'm not on the housing committee, but I think we're supposed to build something like 30,000 units of housing a year to get back to what I remember when I moved here in the 90s in terms of cost and affordability. And we are lucky if we build 19,000 units of housing statewide a year. Okay? That's a really big gap. Okay. Did we do enough about drug use and addiction in the 2024 session? So the guy that was reading my resume, he mentioned 2 bills that I worked on. The nurse staffing bill, the hospital staffing bill, Peace Health and Providence in the metro area, they are having big disagreements about the meaning of that bill that I just passed 6 months ago in terms of hospital staffing. And then the bill that I worked on to try to make ballot measure 110 operations better, I think it improved operations, but it didn't improve the politics of that enough that we didn't make changes fundamentally to ballot measure 110, which this is not a speech about, though I could go on and on about why that whole thing failed. In fact, there was a debate. Where's the guy that was supposed to write my speech back there? There he is. We debated, right, whether or not this should be a ballot measure 110 discussion or, okay. Okay. Can we fix the broken public defender system and make sure that the poor are represented in criminal cases? Because we're obligated to do that by our Constitution, both our state and our federal Constitution, but also actually attract lawyers to do that work. How many of you are from Portland? A chunk. Okay. Have we done enough to have downtown Portland come back? Okay? I mean, here's the thing I'll say to the rest of you that didn't raise your hand, okay? How that city does is vital to the rest of the state. I hope you know that, okay? If Portland struggles, our state is going to struggle. Do we have to raise any taxes? Those are fun votes. Everybody loves paying taxes. Can we address the kicker? How many of you know what the kicker is? About half. It's this really weird tax law that if we take in way too much extra money, instead of being able to have government spend it on like the youth behavioral health crisis, we have to give it back to your parents. Will we ever get around to fixing the messed up property tax system that we ruined in the 1990s? Takes a constitutional measure to do that. Will we invest in higher education and get our universities to be able to lower their tuition? Because we certainly don't offer enough, we also don't offer enough scholarships to make it easier to afford community college and higher ed. Oh, and what about the K-12 budget and the challenges that teachers and students are having? Should we ban cell phones and improve teacher training and then, reduce classroom size? Those are all things that are going to be up in the legislature. And then meanwhile, transportation is looming. Our Highway and Roads Bridge Agency, ODOT, is running out of money to maintain roads and bridges. They're claiming they need $1.9 billion additional dollars on top of what they're already getting to just do the job they're already doing without making significant improvements, just to keep the wheels on, as they say. And yes, the federal government helps with all this, but county and city and local and state government is sort of the foundation of what you all experience. Okay, have I sold being a state rep? Anybody else want to sign up for this job? No. I mean, I actually, as difficult as it is, okay, it's also wonderful and amazing to be able to get to do this, okay? If you had said to my 19-year-old self in the 80s in a rural Ohio university, way skinnier than I am now, bad skin, a really bad mullet, okay, poor music taste, okay, that I would be moving to Oregon, run a student activist organization, my skin would clear up, I'd get a better haircut, and someday I'd be able to actually run for the legislature and be a part of the government that I spend a lot of time trying to lobby to get to do things, I would never have believed you. Okay? Okay, any questions about anything I just asked about? How are we doing on time?
Sir, you have about 15, 20 minutes.
Okay.
Many Q&As.
Okay. So any questions about any of that stuff before I get into healthcare and behavioral health and addiction? Anybody want to express an anxiety to me or something they hope I work on better?
Just raise your hand.
Oh, somebody in the back, a brave human. Go ahead.
Wait for the microphone.
I'm loud.
Okay, I can hear you.
My name's JD. I'm a person with lived and living experience as a peer for mental health as well as addiction, both substance abuse situations. And one of the things that we really need help on in this state is prior authorization reform.
Okay, that's on the list.
That's
When
the
I get
thing
to the
I'm very
healthcare
passionate
stuff,
about.
that's on the list.
I look forward to hearing more about that. Thank you.
I mean, I'm not going to go deeply into it. It's super nerdy, okay, to talk about that, okay? But like, we are definitely the practitioners are very grouchy about the way health insurance acts toward them with regard to prioritization, and that's absolutely on the list for the 2025 session. Go ahead.
Hey, my name's Mary Trefas. I'm a therapist at the School-Based Health Center here at Churchill
Right on.
High School. And I'm curious, one of the struggles that we have is reimbursement rates for OHP
Yes.
clients. And I'm wondering if you can speak to that and kind of the work. that
So
you've been
I
to
will
do.
talk about that too when we get into this. So I think I regaled you with the state budget is like either $1.21 billion every 2 years or 123 million, excuse me. It's either 121 million or 123 million. I mean, when you're talking that many billions at that point, 2, 3, it's not really, there's not that much difference. I believe so of that 121 or 123 billion, excuse me, about 30 billion of that is spent at the Oregon Health Authority, where Ebony works. Okay, I can assure you she's not kicking down that kind of salary. She does fine. Okay. And then of that 20 billion, I think, is what we spend on Medicaid. And, you know, I told you 5 minutes ago I wanted to fix our state's property tax system. Instead, I've ended up working on behavioral health and healthcare. And what I found out this summer, so I've got a lot of seniority now in the legislature. I'm rolling into my 12th year, okay? And if you don't screw this up badly, they start to give you actual assignment and responsibility, which unfortunately for me, I've not screwed it up very much. And so I am sort of right now the policy keeper of Medicaid in the Oregon legislature. There's 90 of us, and I'm probably the smartest legislator about Medicaid. And I'm not trying to brag about that. I'm just trying to help you understand that there's 4 million of us. 1.3 million Oregonians are getting their health care through some version of Medicaid. There's 4 different kinds of Oregon health plan within that program, okay, depending on if you're a kid or you're sort of poor or very poor. So 1.3, it's a really big deal. We believe we are already starting $500 million short of what we need to have for current service level. That's government parlance for saying, what does it take to do everything we're doing exactly the same, accounting for inflation and enrollment changes? So in a $20 billion budget, we're already short $500 million to keep doing everything the same. And if we don't find new money, new taxes, we either have to reduce benefits or kick people off the Oregon Health Plan. I don't think we will do either, but that's going to be an open discussion starting in January. Anybody else want to ask a question before I get into the behavioral health and healthcare stuff? Or make a comment? Nothing's on your minds? Let's get in. Okay, all right, okay. So one of the challenges with being a healthcare policy leader in the state legislature in the United States is the way that our healthcare system is set up. No other country does it the way that America does it. There's variations across the planet, but there's very few that do it the way that we do it, which is you get one kind of health care if you're old. Okay, that's Medicare. You get another kind of health care if you are poor, or if you're kind of a poor kid but not super poor, depending, okay? And that's the Medicaid program. That's the Oregon Health Plan. Half the children in Oregon, by the way, are on Medicaid. Half the babies born in the state of Oregon are born in a hospital insured by Medicaid. Now, if you're working, okay, but you're self-employed or you have a small business, you probably have an insurance plan that is regulated by me at the state of Oregon. But if you work for a mid-sized company or a large one, heck, if you even work for the University of Oregon, you're in a multi-state insurance plan that's under the ERISA, a law that was passed in the 1970s, the Employment Retired Income Security Act. And that means the federal government is regulating your health insurance. And if you have a problem with your plan at your employer, there's nothing that your state representative can do to help you, except listen, which, sometimes is nice. And if you're a government worker in Oregon, if you work here at the University of Oregon, or you work where Ebony works, or you work where I work, right, you have your benefits through the Public Employee Benefit Board or the Oregon Education Benefit Board, and we regulate that differently as well. So I just regulated 5 different ways that you get health insurance. And that's why some people in America have really good health insurance and sitting along, and then versus somebody else doing the same role in a different employer, in a different situation, could have an $8,000 a year deductible, which is basically not health insurance, in my opinion. It makes it very hard to stand up here before you and say, I'm going to try to fix problems, okay? That said, here are all the things that are coming our way. All right, so there's this thing called the state hospital. How many know about that? Oh, a few hands. Okay, good. So this is where you get to go if a judge determines that you are insane enough that you really shouldn't be living among us for a while, maybe permanently. So we have set up a system where only the criminally insane get to go to that place. If you're just sort of regularly insane, you have to languish at a regular hospital for some extended period of time, waiting to get a bed or not. Is there something we can do about that? Can we get more SRTFs and RTFs built? So SRTF and RTF stands for Secure Residential Treatment Facility and Residential Treatment Facility. These are 16-bed facilities for people with behavioral health and substance use challenges, people who need round-the-clock care, who can't handle it just with outpatient. We don't have enough of them. And if our state could stand up more of them, it might help the state hospital situation, and we can get Medicaid to help pay for it. Your mental health system is county-based. It was set up in the 1960s. We closed several state hospitals in our state back in the late 80s and 90s because we didn't think those were institutions that were really helping people to get better or thrive, and we thought that lots of people that have mental illness could live among us. But we never set up a robust community mental health system. Are we finally going to get around to doing that? What does it take? What will it cost? So the guy that went on and on about me, we deinstitutionalized for the most part in the 1990s, and then it took us until 2021 to spend $1.3 billion on the behavioral health system. And people wonder why we have some of the kind of challenges that we're experiencing out on the streets of Portland or in your communities if you're not from the big city. Who here knows what a PBM is? Oh, excellent. Nobody. Oh, okay. One nerd back there. Okay, raises his hand. Okay. You need to know what a pharmacy benefit manager is. They have a big say in with regard to your insurance plan in terms of what drugs you get to take or not take when you're sick, what's on the formularies, and whether or not your pharmacist at Safeway or Walgreens or your local pharmacist, if you're blessed to have a local pharmacy, is paid properly. Should we compensate pharmacists for the work that they do, even if it means when you go to purchase your prescription, the cost of your medication might go up an additional $10 or $15 per script? We have this thing called the corporate practice of medicine in this state. This law has been on the books for a long time, since the 1940s. It means that doctors and nurse practitioners should make decisions about your care, not corporate executives. However, in America, private equity has been creeping into physician practices a lot of times just because physicians need help financing their operation and they want help. Those of you that are in the Eugene area, you know you've definitely experienced a challenge around this. Are we going to regulate it in such a way where, yes, we will allow money to come in and prop up physician practices, but not do it in a manner that that money is allowed to dictate whether or not you get the kind of care your doctor says you deserve? We do not offer enough scholarships for all kinds of things at university and community college tuition is too high. We do not make enough investment in higher education operations despite this beautiful campus and this beautiful building that we're in. How do we invest in workforce in all things medical and dental and behavioral health, which all require education, often more than a bachelor's degree, if we're going to have the workforce that we need to be able to do the things that our society is saying we need to do in this space? It's really hard. I've just regaled you, I think I'm up to like 20 or 30 problems. And trying to figure out how I get the workforce trained to address some of those things is a real challenge. Everybody wants to be paid. Now, listen closely. Should a psychologist, which is different than a psychiatrist, okay, or a therapist with a master's degree be paid the same as a physician when they're doing the same sort of adolescent health care at a physician's pediatric office? Okay, so here's the thing. If you're a sick kiddo and you go to the doctor to get some mental health, okay, and the physician has hired an expert, a counselor, a therapist, to assist her in providing care, okay, when the physician does the thing, let's say the physician gets paid $100 an hour by the insurance plan. When the psychologist, which is not a doctor, okay, they're a doctor PhD, not a doctor MD, okay, does it, they get $75, okay? And when the master's prepared therapist who has been doing it professionally, is not a pediatrician, okay, is a proper behavioral health therapist that the pediatrician has hired, okay, to help provide care to troubled adolescents in her practice, when she does the same thing that the physician can bill for, she only gets $50. Now, yeah, somebody said, sums it up. That's about right, okay? Now, I'm going to tell you, like, that's a bill that I'm going to work on, okay? A physician came to me complaining about this, okay? And I told him, I said, I hope you don't care about losing friendships in your physician practice with your other physician buddies, because the doctors are going to come unglued. Even though I would argue equal pay for equal work. If I'm doing the same thing that you're doing, okay, and I'm licensed to do it and I'm allowed to do it, I should be paid the same. We'll see. How about this? Okay, watch another one. Should we pay a naturopathic doctor the same thing as a medical doctor when they're doing the same thing in private practice using the same pay codes to provide primary care? Now that physician who wants his psychologist and his master's prepared therapist to be paid the same way that he does is going to come unglued when he finds out I'm working on that bill. Okay, one of my coworkers is obsessed with hospital finances. He has a few bills trying to figure out how hospitals spend their money and make it more transparent. Those of you who are from the metro area, you might remember 2 years ago that sadly a security guard was murdered on the job at Legacy Good Samaritan Hospital in Northwest Portland. So we are also trying to figure out how we can have more safety in hospitals. Sadly, but since the pandemic, most of the social ills of society are showing up in the in hospitals. Somebody asked about prior authorization, okay? So prior authorization is basically the doctor going to the insurance plan saying, I would like to do this thing, can I? And most of the time they grant it, but sometimes they don't, or they make you think about doing it some other way, okay? Can we reduce some of the bureaucracy that the insurance company is basically shoving down practices? They would say to save money, but we would also say to deny care. I mentioned that I passed a big staffing law in 2023 to help nurses in the hospitals. We were the first in the country to put staffing standards in statute and law, but already the hospitals and the nursing unions are struggling to agree about what that law means. There might be a couple of strikes starting in January. The pharmaceutical industry does not think it is paid well enough for the drugs that it makes, that we're having a big fight with them about a program called 340B that helps an FQHC. How many know what an FQHC is? Oh, a few hands. Federally Qualified Health Center, another way that we provide health care to poor people in this country, okay? We give a deep discount to FQHCs when they go to purchase drugs for their patients. But the pharmaceutical industry is worried that that deep discount might also be going to people who get their health insurance from Nike. We'll see. We also always argue about scope of practice things. Is a nurse allowed to do something? Is a therapist allowed to do something? Can only a doctor do that? What about a dental hygienist versus a dentist? I think that's enough. Last thing is Medicaid. And then I'll take your questions or your observations. So Medicaid is 4 programs, okay? We sometimes call it the Oregon Health Plan, okay? There's classic Medicaid, which insures about 500,000 people in this state. It was set up in 1965 along with Medicare to insure very sick people who were also poor. In 1997, we added the Children's Health Insurance Program. It's sometimes referred to as CHIP, which is for children and adolescents whose parents don't have very good health insurance. In this state, up to 300% of the federal poverty level, if you don't have good health insurance and you're at 300% or less of the federal poverty level, you can get your kids on the Oregon Health Plan. Half of the children in Oregon are on the Oregon Health Plan because of CHIP. In 2014, we passed the Affordable Health Care Act was implemented in the state. We expanded Medicaid eligibility. Now you don't have to be very, very poor. You just have to be poor. And up to 133% of the federal poverty level, you can get on Medicaid. And 400,000 Oregonians were able to take advantage of that program and got health insurance. So now we have 1 million Oregonians, over 1 million plus on the Oregon Health Plan. And then starting in July of this year, we're the 3rd state to do this in the country, also part of the Affordable Health Care Act. We're doing this thing called the Basic Health Plan. I won't break it down super much, but you only have to be kind of poor to be able to get the Basic Health Plan. 200% of the federal poverty level or less, you can get on the Basic Health Plan. It's basically like being on Medicaid, and thus we get to a place where 1.3 million Oregonians have health care, have health insurance, can see somebody when they're sick, can get prescriptions filled, but it costs money, and that's why we're already a little bit behind in terms of what it's going to cost to maintain these programs. For the vast majority of Oregonians, their Medicaid benefit is provided by a coordinated care organization. There's 16 of them around the state. It's a little bit like being in managed care. In the 90s, managed care got trashed on, but we have a lot of managed care in this state, and we're going to have a lot of bills to look at that managed care model in the coming session to see if that's working as we try to maintain our Medicaid program. Lastly, I'll say this, because this is supposed to be a conference about youth and addiction and behavioral health. So we deinstitutionalized the behavioral health system for the most part in the 90s, and we didn't stand up the sort of community health, county-based program supports that we should have for lots of reasons, okay? We have started, though, to make investment in that. The pandemic really kind of ripped the Band-Aid off of mental health and all of our challenges. I did swing $1.3 billion. I had help, all right? But in 2021, we started making changes. So the adult healthcare system is challenged and underfunded. The youth behavioral health and addiction system is kind of non-existent. We don't even talk about it being a system. We talk about like if we have providers that are willing to provide care in parts of the state. Okay? So it's a little bit gloomy right now in that space, but I will tell you, to the youngish people in the room, and I see a real mix of people here, the adults are starting to get it. We don't have a way to pay for it yet. We don't have it real thought out as in what sort of systems we should put in place, but we are putting smart people in place to figure it out, to give us an analysis, to write. I know that sounds really boring, but you're at a university, okay? People research things first in government before they start doing something, for the most part. Not always, okay? But quite often, all right? We investigate first and try to figure out what's the smart way to do it, what's it gonna cost, how many humans and buildings do we need to do something, and we have put things in place to try to begin to figure this out, okay? We do understand, the grown-ups do, that if we do a better job with youth and adolescent down the road, it might save us money in terms of all the challenges we have with adults. The problem with figuring out how to do a better job with youth is that while we're trying to find resources to do that, we still have adults that have lots of challenges, and we have to figure out how to pay for both at the same time. I occasionally have a naive politician that says to me, well, if you would just defund 100 beds at the state hospital and swing all that savings towards her amazing idea, then we could, down the road, all that would not be needed. And I just have to kind of look at that human, another politician, and they're smart, and go, well, what am I supposed to do about the 100 people that are getting services right now at the state hospital that you told me to stop serving? You just want me to send them to your house? And that's rude, right? I probably am a little nicer when I say that. But that's kind of what we're stuck with in government, which is if you want to make an upfront investment in prevention or a new program, finding the resources to do that while you're taking care of the problems that you have that are already apparent and very much in front of you is the challenge. So I know I've really sold being a state rep, but it's important that people that care about things participate in democracy, okay? There's nothing wrong with running for office like I did and saying, I want something to be better. Humans in my community, my children, my grandchildren deserve better, and government is a place where that is supposed to happen. We don't always figure it out. We don't always get it right. Your thing isn't always prioritized right away, but that is the beauty and privilege of democracy. And so even though I've just regaled you, I think, with like 40 problems, okay, we do go to work on those problems and try to figure them out and try to make progress. Not on everything all the time to its amazingness, okay? I supported ballot measure 110. I do not think putting people that are in the throes of addiction in jail is going to treat their addiction, okay? But I also think because of the rollout, because of the pandemic, because of our housing shortage in this state, okay, because we suddenly, at the beginning of starting all this, went from being a black tar heroin, cannabis, alcohol state to being one where people are doing really difficult meth laced with fentanyl. All those things kind of came together and crashed the program to the point where voters in my district who own homes or businesses are mad that people are houseless, camping in front of their parks or their schools or their home or their business, doing really difficult drugs. And like saying, you can't say this is okay. And they're right. It's not okay. So, that's part of democracy is also a call and response system. So to that end, how much time do we have for questions?
5 minutes.
Okay. Who'd like to ask me a question? Fire away.
Hold on. Oh, Jesus. I got to sit down now.
Okay.
So part of my job is to help dads with getting their kids back from DHS.
Oh, you have a hard job.
So my voice is Dad's voice today.
Okay.
There's a high need in Portland. There's no beds for men and kids.
I know.
Zero. So
Though I toured a facility where they might try to send some up. Ebony and I are going to strategize over lunch about how to get it funded. We'll see.
okay, I just wanted to say that. Thanks.
Okay.
I just want to make a quick note. When you ask a question, if you could just wait for the microphones, just because we're recording, and so we just
Oh,
want.
excellent. Okay. Go ahead.
Hi, my name's Anna Hildy. I am a child and adolescent psychiatrist as well as addiction medicine
All right.
specialist.
Okay. A psychiatrist,
So
not a psychologist.
I am
Right. Okay.
probably in the minority here, and
Okay.
I have a couple of things.
Okay.
The first one is that I am absolutely all about paying equal for
Okay.
equal pay.
Right
or
on.
For equal work.
I'm going to use
How-
you. Okay. This
but,
is being
but
recorded.
what I will tell
but,
you,
okay.
I have a little but, that the training that I have is really different than a psychologist.
Yes, it
and
is.
a social worker. Now, are all of us important? Absolutely. And should we be paid equally for equal work? But I also would like to say that sometimes, particularly those in my field, kind of get overlooked, and we actually don't get paid for the
Yeah.
work that we really
Here's
do.
what I'll say. If the issue is profound enough that it takes psychiatry, okay, then that should be paid, okay? But if the doctor can hire a professional to just provide counseling and support, okay? The doctor doesn't want to really even do that, okay? Like he or she's, like they hire that person to do that.
And that I totally agree with, and I
Right
will
on.
support
Okay.
you 100%.
We're not in opposition.
We're not.
We're going to figure this out.
We are.
Okay.
The other thing I just want to say is you mentioned like residential treatment facilities, but this could go for all levels of care. So I specialize in working with youth with substance use disorders and mental
Thank
health
you.
concerns. I love what I do. There aren't very many of us that
I
are
know.
doing it. But when you, and I have some, I'm going to present later with some data, but adolescents who have a substance use disorder, the majority also have a co-occurring mental health disorder.
Yes.
And
Yes.
most of our treatment for substance use is not integrated. And it has to be
I know.
integrated.
We're
And
trying.
We have,
We-
that
I
has
feel
to
like
be a
I work
priority.
on bills to try to get those pay codes integrated. Okay, maybe we haven't done well enough. Okay, but I know Ebony and I have been in meetings where we're like trying to make co-occurring, frankly, compensate you better. But maybe we haven't tried hard enough. Where are you from? Oh, I'm from Portland. Okay, excellent. Okay, well maybe I'm your state rep. Okay, we should. Okay, you can find me on the internet. Okay. Okay, yes, here in the front.
Mine's just a simple request.
Okay, excellent. Okay, maybe I can do it.
I appreciate you talking about defense attorneys and trying to attract defense
Yes.
attorneys. I happen to work in juvenile justice, and for instance, in my county, our defense attorneys come from a contracted county away, and therefore our youth rarely, if ever, meet their defense attorney in person. And they're wonderful defense attorneys, and it's not taking anything away from that.
I
In fact,
understand.
we couldn't do it without them. But if you're attracting defense attorneys, maybe look at juvenile justice as one more caveat. The juvenile code in Oregon is different than the criminal code
Yes,
in many
on
ways.
purpose.
On purpose.
Yes.
And so,
So I have a smidge of good news for you.
okay.
I will not be working on that issue.
Okay.
But the state representative literally adjacent to my district, who's also representing a part of Southeast Portland, this guy named Willie Choatson. He was a teacher, and then I guess he was smart. He went to Harvard, okay? Went to Harvard Law School.
Wow.
He's a public defender.
Awesome.
So we're going to have somebody in the legislature that understands this and will be willing to like get it and lift this up and try. So stay tuned.
I
okay?
appreciate that.
His name's Willie Choatson.
Okay, thank you.
Okay? And he
Thank
seems
you.
really nice too.
I love it.
Okay.
I love it. Thank
Okay.
you.
Somebody else with a question? Oh, Ebony, come on now.
I don't have a question. I think I ended 15 minutes early, so I'll be quick. I'll just say again, thank you for bringing up the need around co-occurring, because I think that, quite frankly, we have to think about the concentric circles, and everything is
Yes.
interconnected. But I also just again want to just do the plug to support what Rep Nosse brought forward too, is that we have to be bold, we have to be courageous, and I am always wanting to hear about promising practices, emerging practices, or strategies, methodologies, things that you all are doing or that you're seeing to prove effective outside of just some of our traditional ways, because we can't only rely on our traditional system. You know, I think we have to have a menu of options. And so I know we're gonna be at break shortly, and so hopefully y'all will come and tell me like what's working.
Thank you, and I think we just have room for one more question.
Okay, fine. I mean, I'm going to stick around for a little bit. I'm not going right away.
Find you at
They
lunch,
can
too.
find me at lunch, and then I'm leaving. Okay.
Oh boy. Okay.
Okay.
No, it's going to be good. It's
All
going
right,
to be good.
all right,
Hi,
all
I'm
right.
Haley. I'm the local system of care coordinator for Lane County.
Oh.
I really appreciate that shout out that Ebony Clark gave about the system of care, because when we're talking about these practices that are outside of the norm, I think we can turn to the System of Care Advisory Council at the state, which is very much my leader looking here locally at Lane County for how we can break down these silos
And that's a former state
barriers.
rep that's doing
Oh,
that job.
boy, do
Yeah,
I
she's
know.
really
She's my
excited
Obi-Wan
about it. Yeah, she
Kenobi.
used to sit next to me.
Former Rep Anna Williams. So I just wanted to point to the system of care and your local involvement in your system of cares. Find them for your regions. And then also, we need you to really plug for the system of care mandatory participation from the very systems that we're trying to get involved. I can't do my work here in Lane County unless we have juvenile justice, child welfare, all of our major system players who do not have the time to come to these meetings because they're so overwhelmed by work. So a little help from the state
Right
would
on.
be great.
Okay. I believe former State Representative Anna Williams is bringing a few bills to try to make this work better, easier. That's her job. Okay, last question.
So my name's Ed Zager, and I am the statewide substance use treatment coordinator for Oregon Youth Authority.
Nice to meet you, Ed.
And, you know, every kid that comes into our facilities gets an assessment and has the availability to get treatment.
Right on.
Everyone. We have 4 programs, 4 facilities that are approved by Oregon Health Authority, Health Systems Division, as substance use providers. 2 of our facilities have line item substance use treatment coordinators to oversee, to make sure we're following all the state guidelines. 2 of them, I have put POPs forward 3 times, and 3 times they never reached, well, they didn't even get
For those of you
moved
that don't know,
forward.
POP is a way that in government parlance to say the agency would like the governor to lift up their thing in a budget and get the legislature to pay for it.
Yeah, I mean, this has been, you know, and every year they
Policy
say, well,
option package.
they say put it forward, and then it gets shot down by our agency, I guess. But
So, okay, I'm going to give you a little hint. You got to do this on the side. Go talk to a state representative and see if you can get a state representative to do
well,
it.
I'm retiring December 31st,
It's even better.
so I can say whatever
Okay,
I
so-
want to
so
say.
there you go. Okay, I don't remember if you told me where you live, but I would reach out to your local politician.
Yeah, and so, you know, I mean, it's just frustrating. And the 2 facilities that don't have coordinators are our girls' facility
Okay.
and one of our rural facilities, the one in Burns.
All right. I look forward to seeing you in the halls of Salem. Okay. All right. Thank you all for indulging me with my list of anxieties and worries. And I'll appreciate that you all have opinions about how those things should be solved, and you're welcome to reach out to me, but also reach out to your local state representative or your local state senator and ask them what they think about how they want to solve those problems.